Jake, were you able to get a hold of our PowerPoint?
Yeah, I got it.
Okay, great. Let me know if I need to present.
You can if you like.
See ya.
Are we good?
All right, Mr. President, we're live.
Excellent. Thank you. Good afternoon, everyone. Our first March Vaccine Oversight Workgroup. It's been a busy week, certainly a lot of press, be it from 60 Minutes and Washington Post and Afro newspaper. There's a lot of discussions on equity in the distribution by counties. So looking forward to this week's update. With that, let's go ahead and jump right in to Mr. Powell from the Department of Legislative Services on the data update for the week.
Thank you, Mr. President and work group. Jake, if you'd start the PowerPoint, I can start on slide 1. Some of this will look familiar. I typically start with this. This just shows the change in some of the COVID statistics since vaccines became available. Tests are down 30%. The number of positive cases is down 71%. And the positivity rate is down 54% to a little less than 3.5. That's positive signs. Next slide, please. This is our rate of vaccination in Maryland. The gray line is sort of a moving average over the last 7 days. Orange is second doses, blue is first doses. It looks like in the past week, we've had to play a little catch up from, I think, a delay in distribution due to some weather related stuff down south. Hopefully we're able to make up for that moving forward. Next slide, please. We've just been tracking the ratio of first doses and second doses. A few weeks ago, that dipped below 1, so we were giving out more second doses to first doses. We still are, but that's sort of starting to move back in the next direction. That may be an encouraging sign that we have some supply available to keep giving people at least a first vaccine. We'll continue to watch that. Next slide, please. This is also something that's slightly different than what we've shown before, but our expectation is that deaths are going to decline pretty quickly once our vaccination strategy is working, because the people who are most likely to be hospitalized or die from COVID will have been vaccinated. We haven't seen that yet. I don't think that's surprising. In this case, the blue line is the positivity rate rather than the number of new cases. It's just a slightly different way, I think a better way of looking at that data. Both are going down, obviously, since around the holidays. Next slide, please. This is where Maryland ranks compared to other states when it comes to the percent of population that's received a first dose and second dose. This is based on CDC data as of a day or two ago. You see where Maryland is, which I think, still in the middle of the pack, but I think a little bit improved from the previous week. I think we may be up to, I don't have my notes in front of me, but maybe 31st or 26th when it comes to the percent of population that's received a second dose. So that's an encouraging sign. Next slide, please. This shows the amount of vaccine that the CDC reports has been distributed, but has not yet been used. It looks like nationally that has increased, and it's probably because there was a delay in receiving vaccine, and then all of a sudden a whole bunch of vaccines showed up. And appointments are scheduled and need to be scheduled in order to get that out the door. Maryland continues to be with that blue line, which is the 10 states that are, have the highest percentage of vaccine that's been given to them still on hand. We'll continue to watch that. Next slide, please. Something similar, but for the percent of population that's received a first dose, the 10 states that have given the first dose to the highest percentage of their population, that's that top line. The bottom line is the 10 states that have done the fewest. Maryland is the red line, the average is the dash line. We continue to be, somewhere south of average, but seem to be pulling away, or unfortunately, some of the states that aren't getting a lot of first doses in arms seem to be pulling away from Maryland. We'll continue to monitor that. Next slide will look similar, please. Same thing for second doses. And this is where you get to see that Maryland has sort of gotten from below average to average as far as the percentage of population that has received a second dose. So that's encouraging. Next slide, please. This just shows where Maryland ranks as far as the amount of vaccine that's been given to the state for distribution based on the percent of the population that's eligible, which is those over 18 years old. And we are, I think it's around 13th. So, you know, we're receiving a reasonable amount of vaccine, you know, understanding that everybody would like to have more. Next slide, please. We just wanted to look at the sort of disproportionate impact that COVID-19 has had on a county by county basis. And so, you know, those who are either 10% above or below the what kind of the state average are highlighted. You can see a place like Allegheny County at the top, unfortunately, you know, higher than expected given their population when it comes to cases and deaths. We have that information for all of the counties. And so, again, some have been impacted more and some less than others. And it's just important to keep that in mind when we think about directing resources to where they're needed. Next slide, please. So this looks at those counties as far as vaccination. The previous one was for infections. And I've highlighted the three that are the lowest in the percent of population receiving a first dose and a second dose. They're the same for both of those. It's Baltimore City, Charles County, and Prince George's County. There are a couple other counties that are right outside of that number, but I just wanted to look at sort of the same information as the virus when it comes to vaccines ended up getting in people's arms. Next slide, please. So we did a couple of correlations this week just to sort of see if on a county by county basis, there's a relationship between people getting first and second doses, or sorry, first doses and something about those counties. And what I'd like to point out on this one first is that correlation is not causation. And this simply just shows a relationship between two variables that may be important and may not be. But it just so happens that Talbot, Worcester, and Kent County have the highest percentage of their population as seniors. And Baltimore City, got to move my thing, Charles County and Prince George's County are three of the counties with the lowest percentage of population that are seniors. So that may impact some of the rates of vaccination around the state. Next one, please. Same thing, it's the correlation between people receiving a first dose and the percentage of the county that is white. I'm just gonna breeze through these. Next one. Same thing for percentage of the county that is Black or African American. There's a negative relationship there. And there's one more of these. This is the percent of the population that is Hispanic. That is, again, a negative one. So generally counties with a higher Hispanic population have received fewer vaccines for the overall population. I do want to point out what's most important is we looked at a bunch of these variables that ended up not being significant. These were all, to a social scientist, statistically significant. We looked at poverty, we looked at income, we looked at population density, we looked at education, we looked at access to a car, we looked at internet access. None of those correlated with receiving a first dose vaccination by county. Next slide, please. We've seen this one before. It simply shows for each of these sort of demographic groups what share of Maryland's population they are and what share of the first dose vaccinations they've received. This looks similar to what we've seen in previous weeks, which is something like Hispanics or Latinos are 11%, I think, of Maryland's population, and to date they've received about 4% of vaccines. We'll continue to look at that, especially to see if there's been any change in that over the last couple of weeks. I think it's about time to start looking at that. Next slide, please. Almost done. This shows the percent of the population for these different racial or ethnic groups over time, how many have received a first dose vaccination. So you can see the gray line is white Marylanders. Back in late January, about 6% had received a first dose. Now that's up to about 12 or 13%. And you can compare that to other racial and ethnic groups based on data from MDH. Next slide, please. Finally, we've shown this one before, but this is simply looking at a county by county basis. What percentage of the population is in a county of the state's population, and what percentage of the vaccine have they received? If the green line's lower than the blue line, they haven't received vaccinations proportionate to the percentage of Maryland's population they are. Once again, Prince George's County stands out as being behind. Is there one more, Jake? Next slide, please. Same thing, Nope, that's it. That's all for me. I'm happy to take any questions you have. Thank you.
Thank you, Mr. Powell. Let's go ahead and jump to Mr. Schrader.
Yes, Mr. President, do we have the slides? Whoops, are you going to show them, or is Jake going to show them? Jake, go ahead, Jake.
See, there it goes.
Oh, there we go. There we go. Thank you. If we go to the first slide, first I want to provide an update on Johnson & Johnson vaccine. As we all know, this is now the third safe and effective vaccine. We're following the federal guidance to make it available to all communities. And this week, we will receive 49,600 doses of J&J, and we are distributing it across the board. I did want to say, however, that this is an initial allocation. It is very likely that we will receive less next week for a couple of weeks. What J&J has basically said is they're pushing out everything they have. There'll be uneven distribution for the next couple of weeks, and then it'll start to rise again towards the end of March. So we're paying close attention to that. But when we talk next week or the week after, it is very possible, not only possible, likely that this number will be smaller. If that's not the case, then we'll be very pleased. Could we have the next slide, please? In terms of expanding access, the Vaccination Support Center has now booked over 26,714 appointments. We are working with the counties on the PrepMod upgrade, and it's going to be in place this week to address the unauthorized sharing of links. And finally, pre-registration is on track to launch in the middle of March, and we will be delighted to provide a demo when it's ready for testing. Next slide, please. As we continue to innovate, each week we're working with our technology team and getting feedback. We're trying to test ideas to make our approaches better and better. This past week, we were able to test using the Prince George's County data for Six Flags, texting individuals who we had from our list from Prince George's County. What we had learned is, it takes a while to call somebody, and because seniors are advised to not answer phones if they don't know who it is that's calling, we found that using this text gave us almost a 50% response rate, which was remarkable. And from that response rate, we've been able to register a number of people, and this just gives you an idea of what the text messages back and forth say. And we have made 370 appointments for Six Flags over the weekend using this approach. Next slide. As we've talked before, the governors formed the Vaccine Equity Task Force, and I have with me today Brigadier General Janine Burkhead. Through this task force, we're conducting pop-up clinics that connect community leaders with clinical partners. You can see the leaders who are on this team, in addition to the General or Lieutenant Governor Rutherford, the head of our Disparities Officer, Dr. Brathwaite, and Deputy Director, Dr. Mark Martin. And we've got the Assistant Medicaid Director, Trish Roddy, as another member of that task force. If I can go to the next slide, we just have a couple of pictures. This was New Shiloh Baptist Church, where we had successful shots in arms on the 27th, and we're going to be doing some more later this weekend. And then the next slide is Sacred Heart of Jesus. We had worked with this church on testing, and Johns Hopkins has been very helpful. One of the things we need in all of these efforts, there's 4 critical success factors. We need a clinical partner, and in the case of New Shiloh, we had Safeway agreed to do that, which we were very happy about. That was a critical, and we think that the pharmacies will start to play a more critical role in reaching vulnerable populations. And in the case of Sacred Heart, Johns Hopkins was the clinical partner. And then you need to link the clinical partners with community leaders. We also look for lists and who has lists in that jurisdiction, and then from there put the package together and run the clinic. So we're very pleased with the progress there so far. If I could have the next slide. You may have seen reports today. Now that M&T Bank Stadium is open, we are going to focus the convention center on vulnerable communities. Both Hopkins and UMS are focused on the Baltimore zip codes that are most effective. They have an algorithm for appointment prioritization, and there's aggressive community engagement, and we're continuing to refine the outreach technologies. This, I think, is this initiative, which has been in the planning for several weeks in coordination with Johns Hopkins and UMS. They've tested this at the 40% level, holding out 40% of their appointments for vulnerable populations. They've done the proof of concept, and they are now going to open it up to 100%. And as the general will tell you, there are 4 barriers: trust, transportation, technology, and vaccine knowledge. And all of those are being tackled. UMS and Johns Hopkins both have long lists that they are using, significant lists. And the other thing that they're going to be using, which we believe is going to be very important, are community health workers who will go into the communities and, using the access to the information, talk to people on the ground to encourage them to get their shot at the convention center. So we're going to be watching this proof of concept very closely over the next 3 or 4 weeks, and are expecting results, positive results. And then from there, we'll want to look at replicating this concept around the state. If I could get the next slide. The confidence campaign continues. We recently deployed a sound truck in hard-hit Prince George's County zip codes to promote vaccine confidence. This week, we're beginning to run a PSA with County Executive Alsobrooks. We're engaging in virtual radio town halls to promote confidence, and we have coordinated calls each week with the county health departments about this effort. So that's what I had today, Mr. President, and I'm here with the General to take any questions you might have.
Thank you, Mr. Secretary. Appreciate the overview, and definitely did want to focus in on the equity pieces. Do want to start out on with the positive news, some of the positive things from this week. First, it does appear that there is a rate of distribution that is increasing. It looks like our supply is increasing, which is always a positive thing as more vaccine reaches Maryland. The J&J, I think we're looking forward to hearing the updated distribution plan on J&J, and certainly positive that we'll have this third option that's a one-shot. Did want to commend that it looks like the max vaccination sites are up. There's an increase on the weekends. That was something that was a concern for a while, that the weekends were down, but the last 2 weekends look like they've been up. And then the increase of Maryland proportionally and nationally on the second dose, it appears that Maryland has been doing better on the second dose administration than other states, which is a positive thing. So appears that people are showing up for their second dose and we have the doses available to administer. So really do want to highlight those pieces because those are important improvements in the program. One administrative note, we did try to collect all of the questions from last week and believe that Mr. Powell sent them over on Tuesday. We wanted to get them quickly. We didn't receive them until about 30 minutes ago. We got to work on that process because I think there probably are some answers to questions that are outstanding in there, but getting them 30 minutes before doesn't give us a chance to review them. So just want to make sure that I make that note. But I do want to dive deeply into this issue around the distribution by county, particularly as it impacts the equitable uptake of the vaccine. In the 60 minutes, I mean, we made national news, unfortunately for the wrong reason. So we've certainly received a lot of communications over the weekend. The AFRO did a big front page story about that it not being vaccine hesitancy, but more about the uptake. In the data, it looked like the Six Flags mass vac site, and I just quickly looked at this, so I don't know if I'm reading it incorrectly, but for the Six Flags vac by county, it looks like about 20,000 of the total doses, 20,000 of the 25,000 doses were Montgomery, Anne Arundel, and Howard residents, and only 3,500 of the 25,000 were Prince George's County residents, which seems stark. And just curious. And then, you know, of course, there was the governor's comments about the city's distribution. My sense is that if hospitals are deemed that county allocation, there's some inequity built into the distribution because the hospital has a certain population that it has to hit, whereas health departments, theoretically mass vac sites should be more active. What is your thought on this?
Well, we covered a lot of ground there, so let me see if I can pick.
Well, let's do the mass vac site, the issue of the mass vac site and the residents of Prince George. At least it looks like from today's presentation, the convention center is going to have a much more intentional strategy. Is that going to be deployed at the Six Flags site as well, noting where Prince George's is?
Yes, and that's why we're using the call center the way we are, so that we want to, you know, we know who the counties are that are coming, but we want to focus on Prince George's residents and drive those numbers up, which is why we're taking pre-registrations from Prince George's County Health Department. They're giving us those, and at first we were doing phone calls, and we're you know, that has had some effect, and now we're using the text messaging, and we're really pleased. We think that's going to make a big difference because we want, you know, obviously we want to push for Prince George's Countyans to be using the Six Flags, and so we're gonna try everything we possibly can, and we're really encouraged by this. As I said, this text messaging and the call centers. When we call into folks who live in Prince George's County. So that's our first priority.
So do you think we should see next week? What do you think we should see next week from, is this a change in strategy for the max vac sites, particularly for Black and Latino Marylanders? Should we see a drastic increase in vaccine uptake a week from now?
I don't. Well, I'm going to ask General Burkhead to give a bit of thought on what she's been doing. In my mind, I think we're going to see small incremental increases every week. We've seen some of that. I noticed. I've been watching this week. We've gone from like 15.2 to 15.8, which is not huge, but it tells me that we're starting to get some momentum. So, General Burkhead, would you like to address that question for the Senate President?
Good afternoon, Mr. President.
Good afternoon.
So, drastic, I don't know if I could term it as a drastic uptake, but what I can share with you is our intentional work with Prince George's County to ensure that we are getting Prince George's County residents, Black and Brown, and to the vaccine sites. So the intentional things that we're doing around Six Flags is that texting concept was started and tested on Prince George's County list. I personally speak with Prince George's County almost daily about refining the list and how we can work to get members of that community off that list and in for appointments. So there is a specific set aside for Prince George's County. We have to ensure the county and the state working together are intentional about getting those appointments scheduled and the people in the place for the shot. And so that is one of the reasons why we went back to the SMS texting specifically to that list to enable the Prince George's County residents to ensure we're getting that 500 in there a week. Now, I will tell you that we had some challenges up front when I first started with the Prince George's County list and residents responding. I don't believe that it was an issue of hesitancy. I believe it's an issue of technology meeting the citizens where they are. And so once we were able to figure out that, wait a minute, if we text a person and they respond, and also even before that, we were given a lead time to Prince George's County and realized that even with the lead time with the other technology we were using, there was such a lag time in the time that you may receive the text, and then maybe 20 minutes later, your mom sitting right there next to you receives the same text. And by then, the message had got around to other communities to go in. So we are being intentional with refining the list, not by ourselves, but with the county. I personally speak with the county almost daily about the list. In fact, today we talked about working their 65 and older list because we know they haven't started to work that list. And there's some things maybe we can do around that list under the other things we're doing with vaccine equity that we can do to get our numbers up in Prince George's County.
And General, what would you, thank you, that's very helpful. General, what would you expect next week? How would you know if the strategy is successful? What are you expecting to see?
So I'm expecting to go back to the list where we sent the text and expected those appointments to show up. And so if those appointments don't show up, then we know that then we have people not showing up for appointments. Then further than that, as we refine the list and ask for a new list from Prince George's County, as we follow the data, those text messages come back. We know whether they respond or not. So if they're not responding, then we have to take another tact. And so what is the next piece of that? To take another tact at getting Prince George's County residents into the mass vac site.
And it was 500 you said?
That's correct.
And so the goal would be that all 500 of the 500 of 500 are Prince George's County residents.
That's
and
correct.
fully utilized. Okay.
Yes, Mr. President.
Thank you very much. Thank you, General. Let me do this. I want to make sure that we have time for questions. We have just about 5 minutes per member. We're going to go in the order of Senator Washington, Senator Lamb, Senator Eckert, Senator Young, Senator Rosapep. So Senator Washington, I'll hand it over to you.
Thank you, President Ferguson. It's good to hear, it's good to have you on board, General. And I appreciate your comments about intentionality, because part of intentionality is value to the person that you are working with and communicating with, and developing trust and respect. And Secretary Shader, frankly, I am surprised that you didn't start off your presentation by apologizing or at least clarifying our governor's comments around Baltimore City getting more than it's entitled to, and implying again that we're getting more than our fair share. And frankly, we're accustomed to this rhetoric when it comes to education funding. We're, accustomed to this rhetoric when somehow it has served a political purpose of pitting rural communities against urban communities, pitting Democrats against Republicans. But when it comes to lives, I believe that words really matter. And the fact that our governor would engage in such language that is frankly tone deaf is flat out incorrect and is divisive. Yes, Baltimore City has had more than its fair share. In fact, 4 of Maryland's, of the 12 zip codes that are most strongly hit, Baltimore City has been hit has been hit most, right? Out of the 440,000 cases, 885 of those were fatal. And so, yeah, Baltimore City has had more than its fair share. It's had more than its fair share of hospitalizations. We've had more than our fair share of deaths. We had more than our fair share of infections. And again, more than our fair share. And we actually are joined by this with Somerset County and Prince George's County. So just to get the facts right, Secretary, and I know these are facts, these are your facts, 40% of those vaccinated in Baltimore City have been Baltimore City residents, right? And less than 6% of Black Baltimoreans, who comprise over 60% of Baltimore's population, have been vaccinated. So thus, we do need greater collaboration, but we also need to not engage in this dangerous rhetoric of attempting to pit other jurisdictions against each other, as frankly, and I'm sorry, President, but we have gone through this week by week where when we have questioned the rollout, where we have shown the inconsistencies, where we have shown this unwillingness to sort of take responsibility, that you blame others, you blamed hesitancy, you blamed a contractor, and now you are trying to imply that somehow Baltimore City is taking up vaccines that should go elsewhere. So I would really like you to address, one, how are you going to sort of undo the negative damage that this type of language is implying? Like, it's very counter to what the general has said. So what's your response to that? What do you have to say to not only Marylanders, but Baltimore City Health Department, Baltimore City, these churches that you're going into, and to somehow have our executive imply that they are getting more vaccines than they're entitled to, and not recognizing that we're paying a greater price for those? I'm waiting to hear.
Okay, I just wanted to make sure you had finished.
I'm not finished, but I'm ready to continue to hear what you have to say.
Oh, okay. So my focus last week was working with and Hopkins to drive this new approach that we've been testing for the last several weeks. We want to prove the concept using the convention center, and we are going to be pushing a lot of vaccine through that convention center, going into the hardest hit zip codes in Baltimore. And
Secretary, I'm addressing the misinformation that is being spread by the administration, when your own data, the health department data, says Baltimore City will have 135 doses per 10,000, compared with Baltimore City that has 200, Baltimore County with 237 per 10,000, and a number of other jurisdictions. And, you know, I don't deny that those jurisdictions everyone should get what they need, but can you please address this lie that's being perpetuated, that somehow Baltimore City is getting more than we're entitled to?
Well, Madam Senator, you're asking me a political question, and I'm not a politician. So I'm focused on process and facts. I don't think I can answer your question.
Okay. Well, I would just thank you, President. I would suggest that if language and discourse like this continues from the top, that it is actually undermining your activities, your efforts to build confidence in the community. So it's not a political, it's a community engagement. It's basic community public health 101. Thank you. Thank you, Mr. President.
Thank you, Senator. Next, Senator Lamb.
Mr. President, Acting Secretary Schrader, my first question has to do with the J&J vaccine. I think last week we asked you what the plan was, and you said you would get back to us. In your presentation earlier, I've not heard a really coherent plan as to how the J&J vaccine will be distributed, except to cite the fact that about 50,000 doses will be arriving in Maryland later this week. And the governor, in a press release earlier today, said that state health officials will direct the J&J vaccine to be allocated widely to mass vac sites hospitals, local health departments, and community health centers. I'm wondering if there's been any forethought to target the J&J vaccine to certain jurisdictions or to more difficult to reach populations, or are they simply going to be allocated to these sites just like every other, all the other vaccines that have been allocated so far? I'd like to hear a plan from you about how the J&J vaccine will be distributed, since it's now been authorized, being considered by CDC, and should be arriving later this week.
Mr. Secretary, we can't hear you.
I'm sorry. Thank you for asking that question. I wanted to get into that detail. We just made those decisions over the weekend. Yesterday evening at 6 o'clock, we wanted to make sure we knew how much we were getting, because unfortunately we've had situations where we announced plans and then the doses shifted. So now that we know that we're getting 49,600, we are directing about 55% of it towards M&T Bank Stadium and the Regency in Charles County, Regency Furniture Stadium. We also are sending about 10,000 doses to the local health departments, and the local health departments will get about 16,000 doses total, both J&J and the Pfizer and Moderna. And the reason we're doing that, and then the rest will go to hospitals and a small amount to federally qualified health centers. The White House and CDC have asked us to spread these doses across. They don't want us targeting specific populations. So we are honoring that request and spreading the doses across the various channels that we've established. And you know, so that would include both the hospitals, the local health departments, the mass vac sites, and the federally qualified health centers. And we're also expecting that the federal government, through their program, will be pushing doses out to the pharmacies in their program. So that'll create, their intention is to spread this across every channel.
So I would urge you to consider targeting them. I think there's actually a CDC group that's meeting today to talk about how best to target this J&J vaccine, because it is only a single dose vaccine. And so it may be easier to target it to harder to reach populations if there's risk that they would not be able to show up for their second dose. So I'd urge you to think about that a little bit further. The other question that I had has to do with
Could I comment on that? Because you made a good point, and I wanted to let you know that we're waiting on the final ACIP recommendations. They're going to be spending this week putting out more clinical guidance. And by giving it to the hospitals and the local health departments, we are hoping that they will get some of these targeted populations. So I don't disagree with you.
Yeah, ACIP is meeting as we speak. The other question that I had to do with the Ernst & Young contract. The information that you sent along seems to convey that they've been already contracted since January 21st, 2021. And that's about 5 weeks. And based on what you've conveyed in your written information, they're supposed to really help with improvements to the distribution of the vaccine throughout the state. I think in the last 5 weeks, I haven't seen much noticeable improvement. I see equity is getting worse. We've had a problem with misallocating second doses to first doses, and there's still no single portal available. And yet we're spending, based on my calculation, about $42,000 a day on this contract with Ernst & Young to help with distribution and logistics, which I thought the National Guard was supposed to help with, and they're the logistics experts with the general sitting next to you. They've been very successful in other states to be able to allocate and help with the distribution oversight, and they're free. So it's still not clear to me what we're paying for Ernst & Young to do this over, you know, when you count the options, about $11 million over this period of time. In addition to that, let me say this, that the Board of Public Works, I think, has to be notified of any emergency procurement being awarded out within 45 days of the contract. If the date was January 21st, I think you have 6 more days to get this before the Board of Public Works, and it doesn't seem like they have information about this in their upcoming agenda. You also, I think, based on regs, have 30 days to post this in the email and marketplace. And as far as we can tell, we have not seen that there as well. Can you answer why? And to the
Well, it's
earlier
our
question
intent
too?
to follow the rules and get this to the Board of Public Works within the 45-day period.
Okay, well, you have 6 days to do that, and I'm still not sure what Ernst & Young is doing for us because we're paying them a lot of money. And one of the things that you cite is that they have information about federal distribution that the state can then use to be able to improve our distribution. It seems odd to me that we have to pay a third-party out-of-state company a very expensive sum of money to be able to have some information about how the feds are distributing the vaccine so that we can maximize our distribution. My last question has to do with, is there a, have you had any...
We're running low on time. If you
Okay, one quick question. Have you had any contact with anyone dealing with a public-private partnership to help accomplish a one-stop shop? Have you had any conversations or offers to work on this, either with other departments or groups or a public-private partnership, anyone about creating a one-stop shop? Can you answer that question?
You're talking about, you've pivoted, you're talking about a one-stop shop.
A one-stop
meaning,
shop for a portal to sign up and register.
well, we mentioned last week that we're still using a hybrid model, but as part of that, we are going to be rolling out the pre-registration process for our mass vac sites in mid-March.
That wasn't the question. The question was, have you had any conversations with public-private partnerships on how to accomplish this?
Our technology people have been working to put this together, and we're almost ready to go. Mid-March, they've been systematically putting technology improvements in place. We did the call center, which has been very successful. That helped us to do the text messaging that you heard about. We're calling people off of pre-registered lists. We are offering the counties to work with us and help them to improve their systems with the systems we're developing.
Okay,
right.
Thank you.
Thank you, Senator. Senator Eckert.
Thank you very much. And Acting Secretary Schrader, thanks to you and thank the governor for coming to Dorchester County to see our site there at the Hyatt. It's run very efficiently, so thank you for doing that. But I had a question. I've been getting a lot of questions about levels, the groupings, group 1, 2, and 3. Do we have any data on how many people are in those categories and how we are moving through? I still have a lot of people, older people, who say they're not able to get access. One couple told me they're gone to M&T Stadium to be able to get theirs this week. They were excited about that. So that's my question.
Yep.
Thank you.
So there are about 952,000 seniors, 65 and older. We just put out some information today that Maryland and we have had 40% of 65 and older vaccinated. That also has been part of our strategy as we have looked at the numbers. And one of the reasons why our denominator in the per 100,000 CDC and Bloomberg numbers have been lower is because we put more per long-term care and assisted living facilities into that program, and now we're starting to come out the other end. But what it's showing is that we are doing very well relative to the rest of the nation, and we now have hit 40% of 65 plus. And that total population is about 940,000. So
Do we have
go ahead, Madam
Thank
Senator.
you. Do we have that breakdown by county?
We can get that for you.
For us, that would be helpful. And then to know that's at 65 to what, over 100, right?
Whatever, 65 to.
Okay.
Yeah.
Right, and then thank you. I'm also hearing from a number of our harder to reach populations, we've got a lot of resistance in the community. So we're gonna have to put some extra effort and some extra information. Maybe Dr. Habrowski would be able to get his video out to the health departments and beyond to be able to get those minority outreach workers the tools that they need to be able to dispel a lot of the myth out there. Thank you.
Ma'am, Senator, I
Yes.
had conversations, my team is having conversations with your health department as we speak. We talked about that very issue with her today. And we are planning for an intentional effort down in Dorchester County very soon. We'll make sure you get the date.
Great, and go beyond too. Go down into Wycomico. The whole shore could benefit.
Wycomico, Worcester, Wycomico,
Yep.
Somerset. We're gonna run the gamut.
Yeah, I didn't realize there was that kind of resistance out there, and it's coming from a number of different places. And Val told you all about it if you talked with her.
Yes, ma'am.
Thank
You're
you.
welcome.
Thank you, Senator. Senator Young.
Thank you, Mr. President. First off, I'd just say, I know you've got a difficult thing. I mean, I'm getting calls and emails. Every group wants to be first. Teachers want to be first. Retail workers think they're more exposed than teachers are. I'm getting calls from people with existing problems, particularly I've had about 3 calls with people with Parkinson's wanting to know why they aren't on the list higher up. But I think one of the biggest problems that needs to be addressed, because I still don't understand either, and I'm getting lots of calls from people. What's the process? There are all kind of rumors about who's getting a lot and who's not. Like Senator Washington said, misinformation is being put out. I have 2 friends that tell me they're driving down to Cambridge to get a shot. You know, these mass sites are going to be great when we have a lot of vaccines, but why should people from Frederick have to drive to Cambridge or drive to Six Flags when we have the capability of giving them here? And I'm not just talking about Frederick. This is true in all the areas. We have 1 CVS in Frederick that's getting vaccines. They're in a wealthy white area. We have 2 CVSs and a Giant Eagle that have pharmacies. They're right in the hearts. I guess a lot of people think we're all white. We're soon going to be a majority community. We have pharmacies and right in the heart of where the Hispanic and Asian and African American communities are. They're not getting the sites. They're not getting the shots. They're well below the average of white people getting them. I'm sure a lot of them, if they had access, would do it, but some don't have the money. Some don't have the transportation, you know, to have a car to go. If all this was explained, I've asked the question several times. How much say does the local health department have in where the vaccines are distributed? I think you just said there's going to be 16,000 given to health departments in Maryland. Well, I'm assuming there's 24 health departments. Based on population, I guess Frederick's health department is going to probably get 500. There might be some that are going to get 200 or 300. The rest are going to the mass sites and people have to drive there. I think we could make it a lot more convenient and get it out, the information out. But the big thing is who's making the decisions and how and why, and what's the transparency and who's explaining what's happening. Because the public is, I don't know, And I'm getting all kinds of calls from the public, and I'm sure everybody else is, and I don't know what to tell them. And I think the state's got to do a better job, and they don't need 1,000 graphs or 10 pages, just some explanations of how it's being done, what the hope is, how are you reaching various areas, and that's not happening.
So if I might clarify, Senator, when I said 16,000, that's 16,000 additional doses on top of the 32,000 doses. So the total doses to the local health departments will be about 50,000 doses, which is about a third. So we're trying to be consistent.
No, wait a
So
minute. You said 50,000 doses statewide. You said 16,000 to the health departments.
Yeah, that's the J&J, but then on top of that, we've got 59,000 of Moderna and 69,000 of Pfizer. So when you add all that up with the 50,000, so that adds up to about 150,000. And we had been given a third of the doses to the local health departments, so the 16,000 keeps them on pace to have a third. I'd also mention that we did have two conversations this past week with Frederick County. I was on a call with the county executive.
She told me she talked to you.
Yeah, and she had asked about providing more doses to expand their drive-through, and we are going to be providing more doses this week to the local health departments, and we're asking all the counties to tell us what their maximum throughput could be, so that as we get more and more doses, we'll be able to push them out.
Well, on the minority situation, why can't you get them to the communities where the minorities are, instead of making them? I mean, you're making a lot of people drive all over the state. Some can afford to do that, but as far as the minority populations being so low, and there's places right in those communities where you could put them, but you're not.
Yeah, I'm not quite sure how to answer that question.
Is there a reason?
Our data shows that we are equitably distributing the doses across all jurisdictions based on their population. I don't know. Did you want to comment, General? Yeah.
Senator Young, Janine Burkhead. I can add some context to some of the things that the Equity Task Force will be doing to reach underserved communities, the communities that you just talked about. One of the things that might be of interest is the mobile vax that we'll put on the street that can come to a community near you. There are a couple of different types of that, but in general, they'll be able to come to a community with the assistance of the health department there, working with the health department, and that's why we ask for a liaison, because the health departments know their communities best. So a health department can say and provide data information about where that will best fit for your community, and have that mobile vax set up for a couple of days to give the vaccine in that area.
How many mobile vaxes are there?
There are 3 of the one type that is truly a mobile unit that has been converted, and that will be on the street as soon as we are able to clear one more hurdle for a water issue that has to be cleared up, and there will be 3 of those. And then there are also FEMA trailers that we're looking at as well.
Senator,
my time's up, but
we got to move
Yes,
along.
my time's up. But three mobiles aren't going to cover the state well. When we have an Asian and African American and Hispanic centers right in the neighborhoods. So if they were just sent there.
I think
Sir,
I'm
that's why
finished.
we were asking to work with the community, and through a process, then we can get an assessment done and have someone come out to your community locations.
let's have a follow-up specifically on these mobile sites or mobile distribution in community centers along those lines. We'll follow up directly on that with Mr. Powell. Senator Rosenfeld.
Thank you very much. I want to ask the General, the lists that you said you were calling in Prince George's County, those are lists you've gotten from the county health department, right?
Yes, sir.
Okay, I just want to clarify that because the state does not have a list. And Prince George's County has 65,000 people on their list, many of my constituents. And it's great that you're taking people off those lists to get them to come to your site. That's a big step forward. I will tell you, however, that your statewide call number, which I applaud because we said everybody can't go online. I called it twice last week. I called it at 3 o'clock this afternoon. When I called it last week, I talked to two nice young ladies who told me, as the recording had told me, we have no appointments available. And I said, so where can I get an appointment? And they said, well, give me your zip code and I'll tell you the drugstores you can go to. I said, okay. Do you have a wait list? Can I just put my name on the wait list? They said, no, we have no wait list. Today I called back and nobody answered the phone. I went in a circle on the phone tree where it said, are you interested in talking to a real person? And I pressed yes. And a recording came on and said, we have no appointments. Go to our website, but would you like to talk to somebody? I said, yes. I did that 4 times. No human being came on. You gotta up your game here, folks. I gather you're going to start keeping a wait list. When is that going to happen?
Yeah, in mid-March, we'll have a pre-registration system up.
Okay, that means you'll make appointments over the phone?
All right, we're making appointments over the phone now. The problem is, as we open up and get more doses like we're getting, we'll have more appointments to give.
But help me understand, why can Anne Arundel County has a wait list, I believe, of 25,000 people. Prince George has a wait list of 65,000 people. Why, if they can do it, why can't the state do it? What am I missing?
Because then we'd have redundant wait lists.
Well, that's why Senator Lamb wants an integrated system.
We want the locals we want to give the locals the autonomy to work their lists, and then as we support them, we help them.
Then let me make a constructive suggestion. Why don't you change your recording on your statewide call thing and say, call your local health department, here is the number, and get on their wait list. If you really aren't going to have a wait list and you want them to be on a wait list, your people should tell them that. So
That's a great suggestion, Senator.
Senator, can I add? I just want to add to that. So where do people call? Where should we tell people to call? I guess now I'm confused. Should they call their health department? Should they call the retail? Should they call the hospital? Or should they call the 1-855?
So the 1-855 MD GoVax is doing 2 things. Its principal mission initially is to get appointments for the mass vac sites as we grow them. And with all these doses coming, these mass vac sites are going to be critical to getting shots in arms. In addition, when you call that number, if you are a computer user or you like to work offline with a text, we'll have various options, chat bots or other kinds of technology, but that's only if you want it. You're asked if you can do that. And then the third thing is to make help people with the website covidvax.maryland.gov. But to get back to the Senator Rosapep's point, we want people to pre-register in their local jurisdictions, and then we will support those jurisdictions.
I think that's a good move in the right direction. I think it's good as long as we don't go to a unified site, which is what we should do and other states are doing, as Senator Lamb keeps saying. But if we don't do that, I think your centralized website and your centralized phone line should tell people where to get on a wait list in their community, because otherwise it's exactly the question that Senator Ferguson was asking.
That's a good point, Senator Rosapep. Thank you.
I got one last issue, Senator.
Very briefly.
My understanding is that the number of doses that we've gotten from the federal government tripled last week. Part of that was the delay of stuff tied up in Texas, but a lot of it was the federal government is pushing out many more vaccines. And I guess I would like for next week clarity from you on what the real scale of dose we're going to have, because the notion of all this shortage is changing very quickly, and I'm concerned that we don't have the infrastructure to get these in people's arms as we get them, as the supply increases. And that's why we still have places, including Prince George's County, where the the ratio of vaccinations in arms to vaccinations in the warehouse is much too low. So they're growing. Supply is growing. We have to get the infrastructure growing to get the doses in people's arms as soon as it arrives, not a week later, not 2 weeks later. So I'd appreciate some data on that.
We're simpatico on that. That's why as soon as we get this week, it's going straight to the mass vac site in Charles. We're going to be opening on the Eastern Shore. We're going to be opening in Western Maryland. And we're asking the hospitals. The hospitals gave us a list of what they can handle, and we gave them a substantial boost. So you're exactly correct.
Well, I hope we see that ratio improve at the end of next week dramatically.
Yeah. If I might add one other point, because you raised something that I think is really, really important. Based on these conversations we've been having, we spent a lot of time, E&Y helped us with this, getting access to the right people at CDC and the federal government. What we've learned, as we've been studying the numbers, when you look at the daily rate of doses administered, we're the 19th largest state in the country, and every day we are either 18 to 21. So we are right on the money with the rate of doses per day administered. Where we've got a problem is that the inventory that is at the denominator is a problem for us in two places. One, we now know that the federal government has several thousand, tens of thousands of doses that they are holding, and in our name, but for federal employees that we don't control. So that's driving down our per 100,000 number. We're trying to get to the right person. We just learned that through conversations with CDC last week, at the end of the week, and we're trying to find what button do we push to get, and we're talking about tens of thousands of doses that are assigned to Maryland in the Bloomberg denominator that are not on our books. So there's a difference, you'll see 1.8 when you go into Bloomberg or CDC. We're tracking 1.6, and our understanding the federal government's used about 25% of the allocation that they have, but it's on our inventory. So we'll keep you informed on that, but that's very important. But our focus is on shots in arms, and every day we track it, and we are right at 19, which is the size of our state, every day, and it varies between 18 and 21 as to the rate of doses per day.
Great. Well, thank you, Mr. Secretary. Thank you, members. We're just a couple minutes over. We have a number of follow-up items. We'll make sure that by tomorrow afternoon that we have all of those follow-up questions aggregated. It would be excellent if we could get those before Monday, if we could get those answers, ideally by the end of the week. But of course, understand that there are a lot of things going on. It just makes these much more efficient and helpful and data informed. We got a lot of work to do. We're still getting there. Thank you, Mr. Secretary. Everyone stay safe.
Thank you, Mr. President. Have a good